Info for patient.
While removing the disease from the tip cells, we have concept in our mind that the facial nerve becomes superficial here. So what should be the proper landmark that we must avoid the injury to the facial nerve when removing the disease from the tip cells?
There is a sagittal plane. As I said earlier, that the lateral semicircular canal is the most important landmark.
Right, sir.
So the vertical part runs in a sagittal plane which is deeper to the lateral. So I think it is always better to start drilling from the top,
Right.
from the lateral semicircular canal, and then drill it all the way down and make it a flat kind of bed, what we call.
Right, sir.
And drilling without that into the tip is not a safe. And if you are experienced and if you can identify the digastric ridge, that's a good landmark. But a lot of times it's not there as we see in the book. So I think the best thing is that starting from the lateral semicircular canal, as long as you know that in a sagittal plane you are superficial to that, you're safer.
Right.
You can drill all the way down to the tip. If there's a ridge, you can drill that, but you have to be comfortable with that.
Most of the time, we are not sure because it is a quite hidden area. You are working behind the sinus tympani. So what you do? You thin the metal wall or you use any endoscope to see that area? What you do? What is your...
I think that's again the area where you should leave it till the end. Take the facial ridge down as much as possible. Change the angle of your microscope and the patient. If you're doing post-oral, you have to turn the patient head towards you so that you can look into that difficult corner. Once you have identified the facial nerve, the oval window, you can actually drill down the pyramidal process, because pyramidal process is the thing which is between you and the sinus tympani. So you can easily drill it down, because if you can see the facial nerve going down, the second turn and all that, you can drill down the pyramidal process and have access into that area. Traditionally, people used to use these mirrors, because that was the time we didn't have endoscope. It's an excellent idea to use endoscope in this situation. So I think using endoscope as an adjunct to your ear surgery can be extremely useful in these situations. All hidden corners you can look around with an endoscope and clear the disease under direct vision.
Right, sir. Endoscope means 30-degree endoscope.
Degrees.
30-degree endoscope.
Yeah.
Right, sir.
Even 0 degree gives you wider angle.
Yes, sir.
Even if you use 0 degree, it'll take you into the sinus tympani. But 30 degrees would be even better.
Regarding the myoplasty, sir, this is a very important step in mastoid surgery. Not sure that you have removed the 100% disease, the myoplasty cover later on.
Yes.
So, what is your...
Essential.
Yeah. So, what is your tip to make a good myoplasty?
When you're finishing your surgery, just tell yourself that you need another half an hour.
Right.
Because that is where everybody's tired, you are tired and you want to get away and put the pack in and go away. I do not do any mastoid without Pyelolithotomy.